Dear friends, I welcome you to my channel. Today I have a really, I don't even know, cool guest. There are so many epithets I want to use. Earlier, while speaking with the guest before this recording, I asked how I should introduce you. And there are so many titles. She told me to just introduce her as a doctor, but I think when a person has so many titles, you can't just leave them unmentioned. Well, it's silly, because none of these titles just fell into your lap. You earned each one through hard work. So, without being modest, tell us, who are you?
Hello, thank you for the invitation. I'm very pleased to be here with you. Plastic surgeon Natalia Yevgenyevna Manturova, who graduated from the Second Medical Institute. At the time I entered the residency program at the Institute of Plastic Surgery, which is currently located on Olkovskaya Street, and received the title of plastic surgeon. And then, as various requirements were met and necessary steps were taken for the specialty of plastic surgery to become more civilized, I also received the title of head of the Department of Plastic Surgery at the Nikolai Ivanovich Pirogov Medical Institute. I was appointed as the chief freelance plastic surgery specialist of the Ministry of Health of the Russian Federation, and I try to fulfill my duties honorably and honestly.
But are you also the chief plastic surgeon of the Moscow Department of Health?
Thank you.
I told you, he's just being modest. By the way, it's especially nice for me because I graduated from the same university, so I'm always happy about that. We always had a rivalry, you remember, about which was better, the first med or the second med, and there were always arguments. And when I see someone from the second med achieving such heights, it always makes me very happy. I have many questions, so let's begin. I would like to start with the choice of profession. I seriously wanted to be a plastic surgeon until about my 4th year. I can't even remember when that changed. So, at first I wanted to switch from plastic surgery to cardiology. I wanted that for about a year. And then it just happened that I became an oncologist. Everyone has their own story about how they came to the profession and how they decided that plastic surgery was exactly what they wanted to do, that they were passionate about it. Tell us your story.
It's interesting. You decided to change your mind in your 4th year, but it was in my 4th year that I saw the magical phrase plastic surgery for the first time. And that's the only field that interested me. For some reason, I immediately decided that I would develop myself in this direction. Because before that, I was searching for myself everywhere, in every year, in every rotation, and I realized that something just wasn't right for me. Plastic surgery is probably a kind of magic that involves something that's in your hands. It's about improving appearance, prolonging youth, enhancing a person's quality of life, and solving many, many problems related to beauty. After all, beauty is something inexplicable. And when you realize that thanks to your education and abilities, you can solve all the problems related to beauty and youth. Of course, that's appealing, like every woman who looks at herself in the mirror every day and tries to look good, attractive, and better with each passing day. It's even better to think that you can offer the same to other people and improve yourself in this field. Of course it is. It seemed tempting and the most interesting to me because, well, it's hard to argue that beauty and youth have always been and still are relevant. That's why I decided to connect myself with this field. And after graduating from the institute, during my residency at the Institute of Plastic Surgery, I developed as a plastic surgeon among a team of highly professional specialists. But my direct supervisor and mentor was Valentina Gennadievna Zmazova, an honored plastic surgeon, a leading specialist for me. She always has been and always will be my leading specialist. That's my story.
So, Natalia Gennadievna, weren't you scared? Look, for example, when I came to oncology, sick people would come to me and things were already bad for them. For example, even in urology, someone already has a stone and comes to relieve the pain. In your case, yes, healthy people often come to you, and we know oncology can be unpredictable. We did all we could, but it didn't work out. But in plastic surgery, this burden of responsibility, I think it would be difficult for me. Maybe that's why I hesitated somewhere, because any mistake is visible. Do all plastic surgeons fear responsibility, or did you personally experience and handle it? This is your calling, and you overcame it in yourself right away.
The more you learn about the profession, the more experience you gain, the more the fear fades away. You feel comfortable, you see the problem, you already understand from your experience communicating with patients that you have a reasonable patient in front of you, someone who clearly understands their problems and trusts you. You calculate accordingly the entire sequence of actions. You carry out and suggest preoperative preparation, examination, and the rehabilitation period. You are in an absolute comfort zone. There is no fear at all. As soon as fear appears, it's better not to touch the patient. There must be absolute and complete confidence. Well, of course, it didn't come right away. I want to repeat once again that this confidence came after a long period of training. Every day I stood in the operating room with our teachers. We attended dressings, consultations, and shifts, and we took in everything: how things should be done, how long a consultation should last, and what to pay attention to. Well, of course, there were also unpleasant situations when, one way or another, there were complications, and this was directly related to sorting out relationships. But in medicine, anything can happen. But if you've already made up your mind and you're committed to this specialty and passionate about it, then you don't even think about fear.
There should be an awareness of risk, since not everyone knows about this in the budgetary agency in Gdańsk. But before our guests changed the training of plastic surgeons, they studied for only 2 years. Now, thanks to your reform, so to speak, here's what you've done. They study for as much as 5 years. Yes, 5 years, can you imagine? Whereas before it was 2 years. They would go and operate on people, and really that's not enough. For plastic surgery, that's not enough. Tell me, what does the training of these young doctors look like in our country now? Yes?
The federal state educational standard provides for a 5-year residency program, which came into effect in 2022. That was our big achievement. The federal state educational standard sets the professional standard for plastic surgeons. Of course, a longer training period is a guarantee of higher, more reliable quality in preparing a plastic surgeon who will meet all the requirements of the modern world in terms of their abilities, knowledge, and skills. And of course, the specialty of plastic surgery is interdisciplinary, and the departments that currently exist have contractual relationships with the clinical bases of leading medical institutions corresponding to all disciplines. That is, the duration of the training depends on the resident's longer stay at a particular facility. Accordingly, theoretical knowledge and practical skills are acquired to a greater extent as the resident delves more deeply and thoroughly into the fundamental basics of a particular discipline.
So I have a question. What is the criterion for this concept of independent practice? How do you know when a person is actually ready? They probably can't be fully ready even after 5 years, right? Everything's fine. He can do surgeries and likely has a foundation in basic operations.
Well, it's impossible to become such a confident, independent doctor right after residency, no matter how long it was. Of course, as a rule, doctors stay with their more experienced mentors, specialists, and continue to work together for some time. But at the Institute, we had a 2-year residency. In my case, the situation was like this. There were 2 tables, 2 patients. At one table, my mentor, Valentin Gennadiev, was working, and at the other, I started working independently. But she comes over, she watches, supervises, and I know that my teacher is nearby. And believe me, psychologically, it really, really helps. I was calm under any circumstances. And even now, when I occasionally return to the operating room, I imagine her and I feel calmer. It's as if there's someone next to you who will give you timely advice and offer the right suggestion at the right moment. Thank you.
Very often I see both good results and not so good results in various performances on different public pages. And sometimes people complain about this doctor or that one, and I realize that they're actually complaining about a good doctor. I know him and I understand that he does a good job, he has skilled hands, and I realize that he has great skills and comes from a great school. But that's no guarantee everything will go well. There's also chance, fate, and some say the will of the Almighty. And maybe even individual factors like scarring, for example. Many people want to see a top specialist and assume he never has complications.
But everyone does.
It probably happens. What's your opinion on the fact that even in the hands of a super skilled specialist, the results can still vary?
There are a lot of unforeseen situations, like unexpected health reactions from the patient, and this can happen even with the most experienced doctors. We had a case recently, about a year and a half or 2 years ago, where a routine plastic surgery was being performed. And suddenly, an unforeseen situation occurred, something we had never encountered before, like something malignant. Malignant hypertension, meaning it's a genetically determined syndrome that occurs during a state of hypermetabolism in which the skeletal muscles are affected. That is, this condition worsens under general anesthesia or immediately after it. And at the same time, the levels of carbon dioxide and temperature increase, which means muscle tissue starts to die. After all, the patient didn't know about this, and this syndrome is genetic. So of course it's unknown what symptoms might suddenly appear, and it's just something you need to be aware of. Naturally, we discussed this within our community, and now we are preparing in a broader way. Well, for example, how can you predict a thromboembolism in a pulmonary artery branch? Yes, of course, there are preventive prescriptions and postoperative ones. Nevertheless, there are situations when there might be a need for a blood transfusion or some kind of excessive blood loss. That is, all of this can happen to people who are well prepared and thoroughly checked, as well as to people with certain complications. So you need to be prepared for this, and it can happen to any specialist. This is medicine, this is surgery. Of course, the main guarantees of the surgery are the experience of the plastic surgeon and the quality of anesthesia, the anesthesiology team. And nevertheless, even with all these factors, there can be unpredictable, very rare situations, so you should always take surgery, especially plastic surgery, seriously.
People here often blame the surgeon if the result isn't good.
Especially in plastic surgery, because as you correctly noted, people come to plastic surgery not to be treated, but to become even younger and more beautiful. We're not talking about health here. Of course, interdisciplinarity means there are other cases as well, but generally, plastic surgery is perceived mostly as something aesthetic. Therefore, when there are any fatal outcomes or deaths, it naturally causes outrage, confusion, and discussion, which of course has a negative impact on the profession as a whole. I'm not even talking about the plastic surgeon.
But I do get different kinds of patients, for example. I mainly perform major surgeries in oncology, like pelvic exenterations. But sometimes someone comes in with something minor and says, I want to make it bigger or I want to make it thicker. There are such cases in the private sector, and I do those kinds of surgeries too. I work in the public sector and in the private sector as well, but I probably don't perform about 90% of these particular surgeries. I try to dissuade them, knowing that an extra centimeter won't truly improve someone's life. But I see a huge number of people who think differently, who have different values and priorities. They just want to operate. It's the same in plastic surgery. Sometimes on social media I come across before and after results. I look and see a normal girl, attractive, 30 years old, and they're doing a superficial musculo-aponeurotic system lift on her, for example. From my perspective as an ordinary person, I don't see the need. Then they show the after result and, well, it's understandable and she seems satisfied. So should some patients be discouraged after all? Should a plastic surgeon do that, or should he always fulfill any whim? Discussing beauty, everyone defines it differently. If someone likes how something looks on them, is it truly necessary?
Well, it probably depends on two factors. First, you should discourage or refer the patient if you're not confident in your own abilities. And second, if you're not sure the surgery is necessary, regardless of the patient's demands and wishes. And also, if there are any signs that the patient is not quite adequate. Well, a plastic surgeon has the absolute legal right to refer a patient to a psychiatrist for a consultation and to get a psychiatrist's opinion, to assess their mental stability. If it's within normal limits, then absolutely fine. I mean psychological stability. Regarding their complaints and expectations, there's nothing to be afraid of, but sometimes there are hints. There are certain behaviors from patients that make you think. For example, we were taught about this during our residency. If an older woman comes in, well, I mean someone who's 60 years old, and brings a photo, her photo from when she was a 15-year-old girl, or a photo of some actress she really loves who looks nothing like her. She wants to look exactly like that.
I want to order it like that, yes.
You should be cautious here, but there could be two reasons. Either the patient is simply not fully aware of what a plastic surgeon can do. After all, many people see us as magicians, so we need to try to explain. If the information is not being understood, then gently and very politely refer them to a psychiatrist or psychologist. So accordingly, if there are any contraindications, it's better to postpone the surgery, otherwise it could get worse, including legal proceedings.
Natalia Yevgenyevna, doctors don't choose surgeries for cancer. We consider patient reviews about us. In your case, your face is the product and that's how they choose. Now, people check your work on social media like a sculptor showing before and after results. And the bigger the flow of people, the more visible it is. Some people subscribe, observe quietly for 6 months without asking questions, then schedule a consultation and say, I followed you for a while, I like your work, did you operate on my friend? So the question is definitely doctors, right? We're all egocentric, especially many doctors like plastic surgeons. Everyone has bad surgeries, it's just reality. Only those who don't operate avoid bad results. And now, especially young surgeons, they only show super amazing cool results to attract attention. So do you think this is really the case, especially among young surgeons who have just left their mentors, that they only show the good results? And when we make a choice, we should understand that experience is also important, not just the work itself, because most likely we're being misled a little bit somewhere. For breasts, if they're crooked or not attractive, they're simply not shown, but they can be crooked.
So how can you identify a plastic surgeon?
It seems like everyone claims 20 years of experience, starting from college or earlier. I wonder how they count it. I know some people like that.
But of course, this problem has been discussed, and I can say that by now it's gradually becoming a thing of the past, since apparently the system of natural selection is working. After all, the population has become more educated, and to a greater extent, people are looking not at appearances, not at a charming young specialist who might inspire sympathy or trust. And no matter what he does or says, it seems like everyone already likes him. But they pay attention to what we actually talked about and warned about. A patient absolutely has the right to ask for a diploma, a certificate, and to take a look at the office where the consultation is taking place, especially if the walls are covered with diplomas and certificates. This means that the person sitting in front of them is a doctor who is actively involved in their community and profession, has patents, gives presentations, and can show their results before and after. Yes, of course, they can show it, but I don't really know how to explain it. You can still feel professionalism and you can sense charlatanism. Of course, you can still make a mistake, but nevertheless, the main indicators are the credibility of their education, documentation, the conditions in which they work, and the equipment. Maybe even in the clinic itself, we have very strict regulations now. At one time, it caused quite a stir, but now things have become more or less calmer because of it. Because patients understand that they are coming to a clinic, not to beautiful apartments. Yes, to a wonderful specialist called a plastic surgeon.
And not everyone knows, but our guest influenced not only education, but also certification. Previously, you could practically open a plastic surgery clinic in the basement of any building, and there were these little hole-in-the-wall places, and they closed down. I don't know. The number, I think, was in the thousands, almost 9,000. There were clinics that could really harm people. There were no proper conditions. What sets the certified clinics apart now is that they must have an intensive care unit and X-ray equipment to manage complications. Because you said it very well, the most important thing is not when everything goes perfectly, but when anything can happen. A heart attack, stroke, blood clot, or severe bleeding may occur. And dealing with these acute conditions which you can't tolerate, wait, or send somewhere else, you have to act here and now, and that's very important. I fully support that. My brother, a plastic surgeon, is off camera. When you started, he said, "Oh, cool, that's right, thank you." We fully support it and are glad it happened this way. Thank you. I need some advice from you. I've decided to get a nose job. For example, what's the minimum experience needed? What kind of experience should they have? Do you think that after a surgeon finishes their residency, when they're operating more or less regularly on their own, how much experience should they have before I can go to them?
2, 3, or at least 5 years.
So we look at when they finish their training, and then another 5 years of independent work. By then, it's clear that the person has experience, has seen both good and bad cases, and knows how everything works. That's all. Now, about choosing a plastic surgeon, do you really have to fly to Moscow from your region? Or how do you choose a plastic surgeon? Everyone, for example, wants to go to your clinic because you have a very good staff, but some people just don't have that opportunity. So how do we choose from what we have available? Is it enough to review their work, or should you also check who taught them and which school they attended? Now people will watch us and say, "Oh, you didn't study in Moscow where Manturova studied, so I won't go to you."
Of course, that's not right. You shouldn't think that way, because in reality, the specialty has formed and is developing now. And the departments that were established at state medical universities are actually headed by people from different schools. And I am a product of the Institute of Plastic Surgery on Olkovskaya Street, but the institute also employs graduates of the department. This is Nikolai Olegovich Milanov. This is the first Sechenov Medical Institute and the Central Scientific Research Institute of Dentistry and Maxillofacial Surgery, named after Alexander Ivanovich Nerabiev, the department of the Russian Medical Academy of Postgraduate Education, named after Nikolai Alexander Ivanovich Nerabiev. It is headed by his reliable associate and assistant, Elena Viktorovna Verbun-Viktorovna, a professor, honored doctor, maxillofacial surgeon, and plastic surgeon. And the schools that formed separate private clinics, the Pavlyuchenko Clinic and the Korchak Clinic. Specialists who followed their own unique path to achieve their goal of becoming and establishing themselves as highly professional plastic surgeons. The representatives of various schools have created today a very proper, rich, comprehensive, I would say, all-encompassing educational program in plastic surgery. Therefore, the symbiosis of specialists and the symbiosis of schools has now created a program that is implemented and used in every department. Well, maybe with some minor modifications. But it is precisely thanks to the large number of schools, the main and advanced ones, that we were able to create an educational program in plastic surgery that is interdisciplinary and meets all modern requirements, both in Russia and abroad. Moreover, our program now includes a section called the scientific block, the scientific component. Since the specialty has been included in the Higher Attestation Commission specialties, we have the right to form our own dissertation council. And we already have a certain number of candidates for the degree of Doctor of Medical Sciences in Plastic Surgery and also courses in art and sculpture. Because the biggest distinguishing feature of a plastic surgeon from the entire surgical community is the ability to assess appearance and to adapt surgical techniques using the laws of perception of appearance in their practice. Maybe in art and sculpture.
Should drawing be a required subject?
We opened art and sculpture courses at the Pushkin Museum in 2014 or 2015. There was a grand opening, and we still keep in touch with artists and sculptors. And now we have a good working relationship with the Stroganov Academy, and we are very grateful to the artist Alexander Nikolaevich Rishkin and his wife Elizaveta Nikolaevna Rishkina, who is the dean of the Stroganov School. And they regularly hold classes with our residents within the walls of the Institute of Plastic Surgery. And lately, congresses and conferences. Almost no significant major event in the specialty takes place without a session on art and sculpture.
Our viewers are always at the cutting edge of science, constantly sending me links on social media. Check this out, look at that. And in plastic surgery, there are also occasional innovations. For example, someone recently sent me a video of a mouse running around with an ear grown on its back. In general, in plastic surgery over the past, well, never mind. Choose the time frame yourself. What interesting innovations have you liked the most? Maybe some discoveries or techniques, maybe some technologies.
But from a scientific point of view, we are also interested in cellular technologies. And even in the laboratory conditions of the Institute and other clinics, we produce tissues such as adipose and cartilage tissues in order to meet the deficit, the biodeficit of tissues. This is actually a well-known technology that continues to develop, and we hope that we will use it more and more actively in our practice.
Then can you give an example of what can be grown and where it can be used?
We take a certain amount of adipose tissue, form a specific mass, and transplant it after a certain period of time to a person with a deficiency of adipose tissue, meaning it is their own tissue. We do the same with cartilage tissue, for example, when correcting nasal structures. Our plastic surgeons have performed such techniques, but they are not done routinely. They are more at the experimental level, but they do exist and show good results. And so far, the operated patients have not come back with any complications. So we consider this a promising direction and see it as something that doesn't separate plastic surgery from science, as well as regenerative medicine and then bioengineering. As for the technical capabilities of robotics, for the first time in our institute, a surgical operation was performed using the Versios robot. I can't recall the exact name of the operation, but it was performed by a plastic surgeon urologist. And he resolved some issues related to that area, and it was very successful. He'll likely report on this himself at the next Congress meeting. I won't reveal the secret of the new operation, but I'm sure it will spark extraordinary interest and further development in the use of robotics. In fact, robotics has already been used in the practice of plastic surgeons before. And the first operation was performed for correction, also in rhinoplasty of nasal structures. So what makes it remarkable? First of all, it's minimally invasive. It allows for precise targeted work with anatomical structures, and it almost completely eliminates damage to the surrounding tissues.
But the nose, I think, is something that's most dangerous to operate on if it's in the hands of someone who isn't very skilled. You don't want to be a test subject, so you need a certificate, ear, nose, and throat experience or proper instruction from a teacher. You don't have to be an ear, nose, and throat specialist.
You don't need to be an ear, nose, and throat specialist, but you must complete a plastic surgery residency.
Yeah, by the way, many of them also work on noses. How do you feel about them working in areas where they lack much experience by default?
Well, we've stated our requirements. You can perform aesthetic correction of nasal structures, perform rhinoplasty. If you have a diploma or certificate as a plastic surgeon, you still need to complete a residency in plastic surgery. Plastic surgeons aren't particularly eager to become ear, nose, and throat specialists or other types of specialists, but representatives of related fields are interested in this, and I completely understand them. I'll say it again, plastic surgery is a very tempting phrase. It's a world of beauty and youth. That's why every specialist wants to experience creativity, aiming to be more than just a surgeon, but a creative person.
Natalia Gennadievna, in urology and oncology, we use various fillers. For example, for penis enlargement, we can use autologous tissue like fat, but we avoid fat because it often doesn't integrate well. A piece can break off and it tends to migrate more often. We usually use fillers as subcutaneous injections. Sometimes we inject filler into the frenulum to address premature ejaculation. But you probably know that there are different types of fillers, and there are doctors who use fillers that, let's say, aren't very high quality and increase their margin. How much did they make from the patient? Briefly explain the risks of fillers, your general opinion on them, and how you would caution people against choosing just anyone for the procedure. Nowadays, sometimes people do this in apartments. What could happen?
Well, yes, this is mostly a problem for dermatocosmetologists and cosmetologists, since they actively use fillers. If the specialist is highly professional, then there is nothing to be afraid of, especially if they know anatomy well and can feel the layers of tissue on the face. I'm mostly talking about the face. And if the filler is high quality, truly high quality, then there is nothing to be afraid of. But if the specialist's training is questionable and the filler is of unknown origin, then there can be various complications, of course. The simplest complication is lumpiness or uneven skin surface, and the most unpleasant one is skin necrosis. I'm sorry.
Injecting it into the nose can cause tip necrosis.
Up to tissue transplantation. There can naturally be thrombosis of the branches of the veins and superficial arteries, and accordingly, impairment of the facial muscles. Well, these are serious, quite unpleasant complications that actually require surgical intervention for treatment. But of course, mainly uncertified products cause allergic reactions. The issue is autoimmune unpleasant reactions. That's why I think you shouldn't do these procedures at home. You should really try to go to professional clinics. Aesthetic medicine clinics. It doesn't necessarily have to be an institute of plastic surgery or a clinic. But if it's a highly professional dermatology or dermatocosmetology clinic, and if you are treated by a doctor in a procedure room or a specialized office where you can see the proper conditions and professional equipment, then I think there's nothing to be afraid of.
For some reason, I've noticed, and I think you've noticed too, that lip augmentation is always called Botox, 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 Botox. But Botox is botulinum toxin. It's what relaxes the muscles while the lips are actually being filled. Fillers are hyaluronic acid, and that's the question regarding these fillers and everything else. What have you encountered in your practice? Can you give an example of any complication, something you've actually touched with your own hands, seen what happened? Someone went somewhere, just fixed the tip of their nose or something, and so on.
Well, in my practice, I have seen maybe overcorrection, but everyone notices that on the face. Overcorrection can happen with the lips, maybe in the malar area, the cheekbone area. It can also happen with improper use of botulinum toxin, There can be facial asymmetry or some kind of unnatural facial expressions, unnatural mimicry. I believe it all depends on the specialist's experience, so all methods have a right to exist. They are safe and very effective if they are in the hands of a competent, highly professional doctor.
As a specialist. Regarding Botox, because some doctors have started releasing videos saying that if you inject Botox just once, you'll end up looking like a Shar-Pei. We use Botox in urology, and I have a certificate for administering botulinum toxin. We use it in the bladder. We treat overactive bladder or sphincter spasm. We use it for that. And on the contrary, we would be happy to inject it once and be done with the problem once and for all, but we have to inject it once a year or once every 6 months. Overall, what is your attitude as a doctor from aesthetics, from plastic surgery towards Botox?
I have a positive attitude towards Botox, and I want to say once again that everything depends on the doctor's qualifications. As for advertising, well, it can be all sorts of things, and I think that today's audience are citizens. They have the ability to tell where the information is reliable and where the information is still questionable. And there are a lot of professionals, professional platforms, chats are being formed where professionals, representatives of the professional community, provide accurate information and recommendations on usage. And of course, there is also a forecast of the possibilities of a particular filler or botulinum toxin, a particular injection, its effects, duration, and effectiveness. There are many factors that influence the activity of a particular drug. Reading about it is one thing, but seeing a specialist for a consultation is entirely different. And to receive advice directly, taking into account your examination and the anatomical and physiological characteristics of your body, that's the difference. The dose and the amount of a particular medication you might want to use to improve your appearance or health.
Liposuction.
So,
The main question is who qualifies and who still needs to go to the gym. So I come to you, I have this big belly, of course, I don't keep track of my testosterone, I don't understand why, and I say, help me, I want to suck all this belly out. So what are the limitations, and how do you determine that this person needs to go to the gym and this one should go to the operating room?
well, let's start with liposuction. Liposuction is not a weight loss method. Liposuction does not reduce weight. Liposuction is a surgical technique, a kind of procedure that evens out the contour, the body contour. Even the slimmest girls and boys have fat deposits that no exercise equipment or gym can remove, and only liposuction can precisely, specifically, and carefully remove excess fat deposits and even out the contour. As for a systemic dense body type, what people commonly call overweight, well, that's a combination of very well-planned diets, physical activity, and going to the gym. It's hard work and high technology, there's no other way to put it. But if your body mass index is over 35-40, that's bariatric surgery. Only surgeons can handle your belly at that point, using surgical techniques on the gastrointestinal tract, which will definitely lead to weight loss.
Natalia Yevgenyevna, I have a question. I hadn't planned to ask, but you mentioned bariatric surgery. Well, briefly for the viewers, basically it's reducing the size of the stomach so that a person simply eats less. But people have their own attitude towards it. It's like going to get a tooth pulled, because most often the laparoscopic incisions are small and people don't consider all the risks. There was a recent case, but let's not talk about it. But we know that there can be various complications, especially when we operate on organs of the gastrointestinal tract. I also operate on the intestines. I create artificial reservoirs and bladders. And we, as surgeons, know what happens if the intestine doesn't heal and a mechanical suture is placed there. Usually there's no human factor, but it still might not heal and could cause serious complications like peritonitis. What are common opinions on bariatric surgery? What's your view and who would you suggest it for? So when it's already terminal obesity, what can you expect from this surgery?
Well, the surgery does lead to weight loss if the specialists know what they're doing. For example, we have bariatric surgery specialists working at our institute, and I know that the Bariatric Surgery Society has been established. It's gaining popularity and growing in size every year. Their techniques have already been tested. Bariatric surgery is a type of surgery that requires more than thorough preoperative examination because it carries serious risks, as it is a shock surgery for the body as a whole. But I don't want to jinx it. As far as I've seen, bariatric surgeons manage quite well for the most part. Yes, of course, there are unexpected situations, but you also need to listen to the surgeon, stay in touch with them constantly, and not deviate from the instructions signed by the plastic surgeon. This is a serious operation. It's not, as you said, it's not like pulling a tooth. It's not just a simple cosmetic procedure, although pulling a tooth is also sometimes an operation.
They don't see the incision. For example, I recently performed a cis-prostatevesicectomy. There are no organs left in the pelvis. It's a huge operation, but only 3 punctures. They don't notice the big incision or the risks, so they quickly start running and jumping outside. It seems the same happens here. They don't get it. Should we just send a video?
No, you just need to read the memo and all the instructions from the surgeon who performed the operation. If you've been told to follow a certain physical routine and lifestyle for a month, then you shouldn't break it. Because, of course, in the end, all the questions go to the surgeon, but sometimes it's just a shame and sad for the high-class surgical technique and for the specialists themselves. All of that basically comes to nothing if you don't follow the post-operative regimen. When I was studying, we were told that 90% of the success of the operation depends on the rehabilitation period and following the rehabilitation procedures.
Yes, Yevgenia Yevgenyevna, I know there are major names in plastic surgery. We won't mention any names, but I know there's a huge flow of patients there. And I've noticed that surgeons who work in such high-volume places don't always do everything themselves. I mean, they perform the surgeries. Trainees handle the bandaging, and sometimes surgeons don't follow up or see the patient again. What do you think? Is this possible or not? Or does it all depend on your team, on whether you've really trained worthy people? Is it possible?
In my opinion, no, you can't do that. You need to stay in touch with your patient. I have a very good attitude toward my students, my assistants, and the fact that they treat the patient conscientiously after surgery during the post-operative period. And I believe that they do it honestly, with integrity and with full responsibility. But psychologically, the patient always wants to see their own doctor, and the surgeon should understand this even after an exceptionally well-performed operation. You still need to see your patient. You need them to hear you. You need them to understand that they are still under the supervision of an experienced doctor, a surgeon they have trusted. And nowadays, there are actually fewer and fewer cases when a surgeon completely turns away from their patients and forgets about them. One way or another, they come back. No, of course, there are some stars who don't show up right away, but still, they come down from their pedestal and they don't disappear. It's very important with patients. It's very important from a psychological point of view. And it's one of the key components of a plastic surgeon's popularity and trust.
We had an interesting article in Oncourology, and it said that either you perform a certain number of surgeries per year, for example, on the prostate, or you shouldn't operate at all. To perform surgery well, you must operate frequently. But when I look at young plastic surgeons, since there are few patients and they want to earn money, they say they operate on everything, so probably everything is fine. You can't operate that way. You need experience and practice in all areas, seeing both good and bad. Is there even a plastic surgeon who does everything well, or does a plastic surgeon usually choose a specific area like noses or breasts or corrections? How many things can a plastic surgeon do well and in which areas?
Well, back when I was training our teachers, all of them could do almost every operation. And on the face, that's correction, aesthetic correction of the face. If we take into account classical correction with mobilization of the skin layer and with mobilization of the superficial musculoponeurotic system layer and correction of nasal structures, and for plastic surgery, blepharoplasty, forehead correction, autoplasty, correction of the auricles, and surgical correction of the breasts, body, abdomen, liposuction, and endoprosthetics. That is, well, practically everything. And yet, each of them stood out for being most successful at performing a particular operation. Someone was better at eyelid correction, someone at faces, and someone had flawless noses. Yes, he can do everything, but the way he does noses, no one else does, and so on and so on. So I'm sure it's something like that. I think a kind of natural selection happens for every plastic surgeon over the course of their practice.
And it's inexplicable.
Why is it inexplicable? It just fits your hand.
The noses, it turns out
He likes it, the person is passionate. Yes, he can even fit you with a prosthesis. Although, in fact, breast correction is also a separate major part of a plastic surgeon's skill set, because there is augmentation, endoprosthetics, and also enlargement, reduction, and reshaping using local tissues and microsurgical techniques. Of course, all of this happens, and it's a whole separate community. Practically, I could say it's just like rhinoplasty, just like facial rejuvenation procedures. All these fields have their own army of specialists who are formed and give preference exclusively to this topic.
I'm eager to have this conversation with you since we actually have more in common than most people realize. And fat, we also sometimes do liposuction. And breasts, I remove gynecomastia from the andrology side. Do you know what the question is? So we put in implants, we also put in testicle implants. Well, orchiectomy, when we remove a tumor, we put in an artificial sphincter for urinary continence. And we also put in penile prostheses, meaning an artificial corpus cavernosum, both regular and hydraulic. You use them too, by the way. There are also various expanders, not to mention chins in the whole body. You can even get abs now. I didn't know that. They're made from implants and prostheses. Tell me, what does a person need if they're about to have augmentation, that is breast enlargement using implants? They should know about implants.
Well, probably you need to find out what size this person would like to have and then proceed accordingly. During the consultation, the doctor shows the whole range of sizes, profiles, and quality in terms of texture, and of course in terms of safety, integrity, and strength of the shell. That is, well, the access point is also discussed, but it is agreed upon with the patient because it also largely depends on the patient's wishes.
And for how long? We say here, we will place the implant for you. How long will it last under good circumstances?
It's all relative and can only be determined during a consultation. It depends, I want to say again, on the anatomical and physiological characteristics of the patient, as well as the doctor's experience and proper technique, the access and the quality of the implants. All these factors together can guarantee the likelihood of an excellent result.
But as for beauty, how it will look in the end apparently depends on the implant itself, its shape, size, and volume. They were placed, but nowadays domestic implants are not used as often, I guess, and I have a question about domestic implants. We can do it just like they do, and even make it better. We basically have everything we need for that. Probably.
Yes, we can.
We can.
Yes, but for now we're working on it. There are a lot of messages about this at the production stage, because we have everything we need for this: natural resources, technological capabilities, and science. And of course, specialists who could test and give their assessment on the use, on the quality of the product.
What do you think is the most important aspect of mammoplasty?
Well, the most important thing is not to disrupt the main function, which is lactation. So the functionality, the functional role of the mammary gland is the key point in every surgery. So it should be minimally traumatic in order to remain reliably functional while still being aesthetically pleasing. That's the main thing.
But when it comes to breastfeeding with implants, for some people it's possible, for others it's not. And that depends on how the surgery was performed.
It depends on the quality of the surgery. In general, an implant does not disrupt lactation or block the milk ducts. And that's really not just because we were told, taught, or read about it, but because we've actually seen it ourselves. Women have come to us with implants after their first or second child and were able to breastfeed on their own. But after breastfeeding, the shape can change, so sometimes they would come back for a follow-up correction.
When a woman comes in, she's limited in the breast size she can get. For example, she might come in and say, I have an A cup now, and I want a D cup. Or is it more about aesthetics here? If you're a surgeon, do you understand when she doesn't actually need it? A D cup, or maybe a C and a half, though it could technically fit, would look best as a B and a half or a C. Would you try to talk her out of it and say no?
It's not exactly about talking her out of it. You just need to have a delicate professional conversation and definitely use all the technical tools available. I'm coming back again to the photo studio, to all the programs that exist. During the photo session, photo modeling is done, and from the perspective of the body's characteristics, proportions, and size, the implant is selected. There is a program that clearly offers a visual representation of your appearance with different sizes and profiles, and the patient chooses, and then the doctor, an experienced doctor, makes the decision. Of course, with a lack of tissue and the quality of the tissue, the skin can be thin and there may be no fatty tissue at all. But yes, as you said, you can put in anything you want, even a size 10, but we're not talking about size, we're talking about beauty.
I've heard from my plastic surgeon colleagues, doctors, and even non-doctor colleagues, that the final result largely depends on what the patient comes in with. That is, the shape of the rib cage, the initial size, the position of the nipples. There are cases where you can immediately tell that it won't be perfectly even, that the nipples or the implant won't be perfectly aligned. What do you think about this idea, or do you believe that the final appearance depends solely on the surgeon's skill?
I've already mentioned that we are increasingly getting acquainted with courses in art and sculpture, and we already have some knowledge about harmony, proportions, and how to assess the profile of the human body in order to harmoniously select and recreate the shape, particularly of the breast. Lately, maybe I haven't attended such sessions, but I don't remember any plastic surgeons talking about any impossibilities. And they clearly showed the results and brought a patient who had undergone surgery onto the professional platform, who clearly demonstrated an absolutely symmetrical and harmonious result. But maybe we need to gain more experience. It can't be that a plastic surgeon can't handle it. Of course, there are situations like that, but with a wide range of surgical techniques and tools that are well mastered, it's generally possible now to achieve symmetry, the correct placement of the nipple areolar complex, as well as fullness and shape of the breast. To be continued, more to come. I think that, well, there's no limit to perfection. That's why we keep holding educational courses, a large number of sessions and separate events, educational conferences, where in fact the most attractive are the discussions about breast correction. So, of course, some people succeed, some don't, but the specialty doesn't stand still. Discussing the future means we will work on
so that we can deal with patient terrorism. I've encountered it too. For our listeners, that's when a patient doesn't actually want treatment, but just wants to get money out of you, or is simply very unreasonable and just wants something. They come in ready for conflict, just looking for something to pick on. If you don't recognize them and proceed with surgery or any action, you won't solve the problem, and it often leads to conflict. The question is, first of all, how do you recognize them, as you said, and how should a doctor act if they encounter a terrorist patient?
Well, here, of course, you probably have to accept the fate of your destiny and continue to interact from the perspective of professional protection. There is an ethical expert council within the society, which has been functioning for more than a year and has its own charter and its own rules for protecting plastic surgeons and patients. We are happy to review all the cases that have occurred with a particular surgeon. We invite them, and the representatives of this ethical council give their conclusion. The professional community has also signed a contract with an insurance company. Additional conditions are currently being developed that are intended to protect the doctor-patient relationship. And I think that we will build this system of protecting specialists and having an objective approach to the problem that has arisen.
Natalia Georgievna, the question is, we touched on the topic that you have increased the length of training. If we look at the situation of a specialist who used to graduate with a certificate and compare it to today's specialists, how has the situation changed? Who do we have now, and how has their number changed? Since the profession is harder to access, not everyone is willing to study for so long.
Well, the number of residents has decreased, but not by much. But we haven't had any graduates yet because this is our first year, and the 5-year residency program has just started to function and really get going. That's why we have high hopes and serious expectations for improving the quality of training and knowledge of our specialists. Of course, if you don't want to work or study, even 25 years won't teach you, but still, 5 years is the minimum that wasn't determined by us. This is international practice, the necessary minimum education for a plastic surgeon.
And what do you think in other specialties or fields, let's say, not taking urology as an example? Should we raise this question generally so people study them longer? Because we also face this after 2 years of residency, for example, in urology. If someone initially went into urology, sometimes we get a sterile specialist, depending, of course, on the place, who still needs, in my opinion, another 2-3 years of work. I've brought up this question more than once myself.
I suppose so, probably. You can ask yourself this question and within your community make some decisions about extending the duration. But this should be a uniformly accepted decision by the entire group, the entire community, and you need to have very serious arguments for this. As of today, regarding the community, plastic surgery, the specialty of plastic surgery, for example, there have been suggestions to create subdisciplines in microsurgical surgery and hand surgery, because this is a separate, very serious field. And in fact, in foreign programs, it takes up the main part of the training. When forming plastic surgery during residency, then pediatric plastic surgery as a subdiscipline and as a subdiscipline. There was a proposal for military trauma plastic surgery, military trauma as such a subdiscipline. We also operate in military hospitals and help given our training. The ability to use and work with surgical techniques and microscopes, because modern surgical microscopes are very important and in demand now, as well as endoscopic equipment. All of this is handled well by plastic surgeons, and considering that plastic and aesthetic surgeons, as well as maxillofacial and reconstructive surgeons, are very actively performing surgical interventions, they are showing their effectiveness and providing help. We organize similar sessions within our own congresses and conferences, and we also have presentations by specialists who perform surgical techniques that command respect. It's as if life itself has led us to create such a subdiscipline. Maybe in the near future, we will start working on achieving the goals we have set.
Tatiana Evgenievna, in our cancer center, well, it's easier for me to say my center is not exactly a cancer center. In our oncology hospital, which is the Russian Scientific Center of X-ray Radiology, we have oncomammologists. They also place expanders, implants, and perform reconstruction using local tissues. And the question in general, when we talk about plastic surgery, for many people, the first thing that comes to mind is breast augmentation or plastic surgery for the buttocks. But in reality, as you already mentioned, plastic surgery also includes trauma, complex reconstructions, and children who are born with certain conditions. A cleft palate or cleft lip are complex, difficult surgeries, and sometimes, as far as I know, they can be done in one stage. So plastic surgery in our country has split into those who focus on beauty and aesthetics and those who deal with these complex reconstructions. So what is the relationship between these two camps? How do they communicate with each other, and how do they really feel about each other, honestly, as openly as possible?
To be completely honest, it's very respectful because, well, the specialty is approved because it's an interdisciplinary specialty, and in fact, it's a symbiosis of maxillofacial surgery, reconstructive surgery, and aesthetic plastic surgery. But it's all plastic surgery. The goal is to improve appearance, so maxillofacial, reconstructive with elements of microsurgery are stages in the development of a fully qualified plastic surgeon. But there are cases when a plastic surgeon and a reconstructive surgeon perform surgery together at the same time, and sometimes two different teams perform surgery simultaneously, like in autotransplantation or allotransplantation, where there is a team of plastic surgeons and microsurgical reconstructive surgeons. This is a symbiosis of teamwork and approach. And in fact, we work out a large number of clinical guidelines on the sequence of actions and approach in order to perform the surgery competently and precisely. That's why trust and respect are, of course, very commendable. We exchange experience and share skills. We have already moved past the stage when each specialist tried to pull the blanket over to themselves. It has become absolutely clear and obvious that an excellent result can only be achieved through collaboration, by having knowledge that specialists from different fields can share with each other. Only through joint work and some theoretical training can you enrich yourself and feel like a more professional specialist.
Katalina Yevgenievna, I once had a patient, not just anyone, but a very famous person who came to me for help. He didn't understand what was happening to him. He was experiencing weakness, some panic attacks, and he didn't tell me at first. Later, he said that he had undergone liposuction, or rather, not even liposuction, but had a so-called apron removed. He had this apron cut off. And when we started examining him, we saw that he had a significant drop in his fluid levels. He was in a severe iron deficiency, and because of that, a lot of things in his body started to go wrong. And I started to analyze and see that in your clinics, it's customary to look at the patient not just as a sculpture. Here there's a lot, here there's little. If you see, I mean, it's real. I know that this approach is encouraged and promoted in your clinic. If you see that hair is falling out, nails are brittle, if the skin is pale, you will rule out iron deficiency, meaning you notice these deficiencies while many others don't. Maybe they just need more training. So, do you know my question? And what are the risks if a plastic surgeon doesn't rule this out and basically operates on a patient with an endocrine disorder? Could this,
of course, be a preliminary exam? If the patient has iron deficiency, then a prescription and medication recommendations must be made by a therapist or hematologist. And in general, as I already said, only a somatically healthy person without any issues is taken for surgery. And if there are any chronic diseases, they must be in remission. And if the condition is of a general nature, of course, the surgery should also be planned in such a way that it is minimally traumatic and thought out in every detail. Well, the most important thing is to avoid significant blood loss. But during the surgery, anything can still happen. There could be a need for a blood transfusion, there could be a hematoma, there might be a necessity for a blood transfusion. So all these factors can arise one way or another, and you need to be prepared for them. Everything should be organized so that, if necessary, highly specialized medical care can be provided immediately.
yes, Yevgenia Yevgenyevna, have you heard the saying, a great surgeon, a large cemetery? Yes.
A big incision, I've heard that, yes.
A big incision too? And only those who don't perform surgeries have no complications. We surgeons often remind each other of this, and I don't know a single experienced surgeon who hasn't had complications. I'm not talking about your complications, but tell us, young surgeons are probably watching us right now, especially plastic surgeons. So if a complication does happen, how should you deal with it?
You can't leave the patient alone with this complication. Only after completing this difficult treatment journey can you relax and breathe a sigh of relief. And of course, it always seems like, well, that's it, I'll handle this now and I won't work anymore. It's difficult, it's dangerous, it's a huge responsibility, and it's impossible to handle. But as soon as you manage, life goes on, consultations and patients appear, and you go back into the operating room, and you're happy to be in the operating room. And you try to do your job conscientiously, hoping that no complications will occur. So complications are normal, but experienced specialists, of course, have fewer of them than beginners. But unfortunately, you can't avoid this.
I can ask a counter question. I know a huge number of surgeons who continue to operate despite severe tremors, poor memory, and barely being able to stand on their feet. He's 85, still trying to operate, but complications are arising and his reputation is suffering as age takes its toll. But here's a question. Do you think it's worth slowing down, at least doing less, so there aren't so many complications? Surgeons are like addicts. We love operating. Surgery is our drug. So, what would you advise? Maybe as a healthcare administrator, not as a surgeon, but as someone who sees that complications are increasing sharply. Should we stop and say that's enough? We had academician Lopatkin, and he's on YouTube. The surgery he performed with my boss, Professor Pavlov, was his last operation. He finished it, recorded it, walked out, took off his cap and said, "That's it." So, what do you think? Should a surgeon retire at the peak of his fame, or should he wait until there's a decline?
No, of course, you shouldn't wait for anything. I think you need to leave at the right time, but everyone decides that for themselves. He might do it with a sudden move, but I'm not a fan of sudden moves. I still think you need to focus on your students, be in the operating room, but let the students do most of the work based on their own experience. I recently wrote a book about a concept that involves multidirectional distribution of facial soft tissues according to the laws of art. And since I'm not a high-volume surgeon at the moment, I shared this concept with young specialists who have ambitions of earning a Doctor of Philosophy in medical sciences. And those specialists who became interested naturally perform surgeries in the operating room using some principles from my concept in one way or another. And I am in the operating room, and it's enough for me just to be there. I am scrubbed in. I perform some surgical movements and manipulations, but I don't take on the responsibility. Performing surgeries is something completely different. And, I feel so happy to be in this atmosphere again. First of all, I see modern surgical techniques and young specialists who perform them a bit differently, but excellently, with great results. Using the suggestion that I had the courage to present in my book, and I don't feel the need to say goodbye. The doors are closed and I don't sense it. I've never really accepted any diet that completely eliminates something. I believe it's impossible to live without a piece of meat, a piece of fish, or a piece of bread. But it just needs to be done wisely, in moderation, and not in a way that harms your health. It's a psychological factor here as well. Well, life opens new doors with every turn. Sometimes things happen in their own time, but other times you can just step in. I agree, you can't just go and close the doors to the operating room. You can do something like gardening, of course, but I repeat, that's a private matter. I just gave an example from my own life.
I have a question that's come to my mind. The way patients treat us has changed a lot. In the past, if someone got sick, let's say with kidney cancer, they would immediately start searching the internet for treatment in Germany or Israel because it's better and more reliable there. Now that's going away, thank God, because medicine in our country is truly at a very high level. The fact that something is wrong somewhere, take any country at all, you can always find something that's not right. And I'm really glad that people have stopped thinking that things are bad here. I view it from my professional and oncology perspective because there are standards, there are guidelines, and the guidelines we use for treatment are no different from the European or American ones. They are updated yearly, translated into all languages, and we comply with this. When someone says treatment differs elsewhere, I wonder why, if standards say this is the right way. It's not always good. And in general, what is the attitude of the plastic surgery world towards our plastic surgeons right now? And in general, is it better there or the same or even worse now?
But we were never worse. We just never talked about it. I'm not saying that we were aware of all the aesthetic surgical techniques. Some things were new and unknown to us, like lipofilling and lipotransfer. All these terms are now well known and familiar to everyone. But when it comes to the basics of maxillofacial surgery, reconstructive surgery, and so on, our schools and our traditions in surgical approaches have never fallen behind, and neither have our teachers. Many were recognized as speakers, moderators, and honored guests at numerous international congresses and conferences. And yes, there was a time when we were simply interested in learning about, seeing, and getting to know the capabilities of foreign specialists. But when we started demonstrating our effectiveness and the capabilities of our surgical techniques, we didn't look any worse. We immediately attracted remarkable interest and stood on equal footing with recognized, in-demand specialists. And of course, it's probably not our fault that there is still this opinion that if something is from abroad, it must be better. We don't really talk much about this. We just keep doing our work and prove through our efforts that we can be trusted. To be continued?
To be continued. Natalia Yevgenyevna, as a healthcare organizer, you've done a lot, and we've discussed this. These are not just words, as is often the case, but words that have become reality, and this reality has changed the present. That is, we really see how the profession has changed thanks to your actions and deeds, even though you say it's not just you, it's the team.
Yes, it's the team.
Teams exist in many places, but achieving truly worthy results is rare. But you surely have something else planned, right? Tell us, 10 years from now, let's look ahead. What would you like to change in the profession as a healthcare organizer over the next 10 years? And it could be in healthcare overall, not just plastic surgery, in the next 10 years.
I don't know what will happen in the next 10 days. Life is so fleeting, unpredictable, everything changes so quickly. So much happens that you don't even have time to realize or process it. Well, that's how I see it. The most important thing for me, I guess, is to strengthen and maintain what I've achieved. Maybe improve some aspects, maybe create a comprehensive national guide on plastic surgery, a full-scale textbook on plastic surgery, make the clinical guidelines flawless, covering most surgical techniques. And there are more and more of them every day, and it's hard to keep up with the specialists' activity. Well, to keep an eye on the development and maintain the popularity of our plastic surgery journal, which, by the way, is indexed in Scopus. The Higher Attestation Commission journal is prestigious and interesting. We will work on improving its position in Scopus. And yes, one of our main tasks at the moment is to preserve what we've achieved and improve it, probably in this way. And overall, what about healthcare? I hope that I won't be just a random link among those who hope and do everything possible to improve what's lacking.
I have a final question for you and a little remark from me. I walk down the street and everyone looks like they came from the same factory. On social media, it's the same. They all seem mass-produced, with everyone aiming for the same thing. Well, I have this feeling of losing my individuality. You know, these identical lips, identical breasts, identical face shapes. I think beauty is largely about individuality. Yeah, you might not look like some superstar, but that doesn't mean you're not beautiful. That's what I want. So, what's your opinion, your attitude toward the fact that everyone tries to look like someone else?
Our recommendations are always the same. Respect your appearance, your natural makeup, and your inner spiritual world. And if your appearance doesn't match the recognized standard or ideal of beauty, that doesn't mean you're not attractive. Everyone has their own special charm, you just don't know about it. So don't rush to look like or conform to those trendy beauty correction standards that you see everywhere. Take care of yourself, your natural beauty.
Friends, this was Professor Manturov, the face of plastic surgery in Russia.